Why do bone cancer biopsies sometimes need to be repeated? Imagine going to the doctor for a biopsy to find out if a bone lesion is cancerous. Sometimes, the first biopsy doesn't give a clear answer, and that's because several factors can make diagnosis tricky. One common reason is that the initial sample might be too small or not representative of the entire tumor. Bone tumors can be quite complex, and if the sample misses the most abnormal part, it might not show cancer cells even if they are present. Technical challenges also play a role. Bone is a hard material, and guiding a needle precisely into the right spot can be difficult. Even with imaging guidance, the needle might not hit the most suspicious area, especially if the lesion is deep or in a tricky location. This can lead to an inadequate sample that doesn't provide enough information for a diagnosis. Another reason is tumor heterogeneity. Bone tumors can have different areas with varying cell types or levels of malignancy. A single biopsy might sample a less aggressive or benign part of the tumor, missing the malignant cells entirely. To get a full picture, doctors might need to take more samples from different parts of the lesion. Sometimes, the initial biopsy results are indeterminate or show no tumor cells at all. This can happen if the sample was too small or if the lesion is difficult to interpret. When clinical signs and imaging strongly suggest cancer, but the biopsy doesn't confirm it, doctors often recommend a repeat procedure to be sure. Distinguishing between benign and malignant bone lesions can be especially challenging with small tissue samples. Benign tumors may look similar to malignant ones under the microscope, so a repeat biopsy might be necessary for clarity. In some cases, a surgical biopsy is preferred for a definitive diagnosis, but when initial needle biopsies are inconclusive, repeating the process can help. Repeat biopsies are also used to monitor disease progression or how well treatment is working, especially in cases involving blood cancers that affect bones. They help doctors see if the cancer is growing or responding to therapy. False negatives are rare but can happen. This means cancer might be present but not detected in the first sample. Repeating the biopsy reduces this risk and helps ensure the diagnosis is accurate. Accurate diagnosis is crucial because it guides treatment decisions and improves patient outcomes. In summary, doctors may need to repeat a bone biopsy when the first one doesn't provide enough information. This can be due to insufficient tissue, technical difficulties, tumor complexity, or inconclusive results. Repeating the biopsy helps confirm the diagnosis, which is essential for planning the best treatment. However, because biopsies carry some risks like infection or bone weakening, doctors weigh these carefully before deciding to perform a repeat procedure. Always remember to discuss your specific situation with your healthcare team, as they can provide guidance tailored to your individual needs.